During pregnancy, it is important to make mindful choices when it comes to your diet. While there are many nutritious foods that can support you and your baby's development, there are also some foods that you should avoid or consume in moderation to reduce any potential risks. Let's take a look at some of the foods you should be cautious about during pregnancy. First and foremost, it is recommended to avoid consuming raw or undercooked meats, such as sushi or rare steak. These foods may contain harmful bacteria, like Salmonella or Listeria, which can pose a risk to you and your baby. It's better to opt for properly cooked meats, making sure they are cooked to a safe internal temperature. Next on the list is unpasteurized dairy products, including certain soft cheeses like brie, feta, or blue cheese. Unpasteurized dairy products may contain a bacteria called Listeria monocytogenes, which can cause a serious infection called listeriosis. It's important to read labels carefully and choose pasteurized options to reduce any potential risks. Seafood is generally a healthy choice during pregnancy due to its omega-3 fatty acids and other beneficial nutrients. However, some types of fish can be high in mercury, which is a neurotoxin that can be harmful to the developing nervous system of your baby. Avoid high mercury fish like shark, swordfish, king mackerel, and tilefish. Instead, opt for low mercury options like salmon, trout, shrimp, or catfish. Caffeine is another topic that often comes up when talking about foods to avoid during pregnancy. While moderate caffeine intake is generally considered safe, it's important to limit your consumption to around 200 milligrams per day, which is equivalent to about 1 12-ounce cup of coffee. High levels of caffeine have been associated with an increased risk of miscarriage and preterm birth, so it's best to be cautious and keep your intake in check. Raw or partially cooked eggs should also be avoided during pregnancy due to the potential risk of salmonella contamination. This means that foods like homemade mayo, cookie dough, or certain types of dressings should be off the menu. Opt for pasteurized eggs or use egg substitutes when cooking to reduce any potential risks. In addition to specific foods, it's important to be aware of certain food safety practices to minimize the risk of foodborne illnesses during pregnancy. Make sure to wash fruits and vegetables thoroughly, as they can be contaminated with certain bacteria or pesticides. It's also crucial to wash your hands, utensils, and cutting boards properly to prevent cross-contamination. While a well-balanced and diverse diet is essential during pregnancy, it's worth noting that certain precautions should be taken when it comes to deli meats and processed foods. Deli meats may be contaminated with Listeria, so it's important to heat them up until steaming hot before consuming. Processed foods, such as hot dogs and sausages, should also be cooked thoroughly to reduce any potential risks. Lastly, it's important to mention alcohol. The consumption of alcohol during pregnancy is strongly advised against, as it can lead to fetal alcohol spectrum disorders, which can cause physical, behavioral, and cognitive impairments in the baby. It's best to completely abstain from alcoholic beverages throughout your pregnancy. Remember, every pregnancy is unique, and it's imperative to consult with your healthcare provider for personalized advice and guidance on your dietary choices. They will be able to provide you with specific recommendations based on your health, medical history, and any additional needs you may have. In conclusion, being mindful of your food choices during pregnancy is crucial for ensuring the health and well-being of both you and your baby. Avoid or consume in moderation raw or undercooked meats, unpasteurized dairy products, high mercury fish, excessive caffeine, raw or partially cooked eggs, and alcohol. By making informed decisions and practicing good food safety habits, you can support a healthy and successful pregnancy journey.